me a little bit of a push, moving that forward, okay?
Mm-hmm.
There you go. Nice. That was a good clunker, man. I like that. Alright, so I know we talked about some mid to lower back, and then you also said the lower back pain here, right?
Yes, sir.
Where, again, do you feel that lower back pain? Can you point to where you're feeling it?
It's like right here and then right here.
Okay, so right down from the very bottom, and then you said right into that mid to lower back here. Okay.
Yes, sir.
Now, when it actually occurs, do they both occur at the same time, or is it kind of one kind of flares up, or one is like more aggravated, or is it kind of like both? Are they feeling like they're connected?
Yeah, both at the same time.
You feel it's mostly at the same time?
Yes, sir.
Okay. Do you feel any pain radiating out to the side, or is it just kind of focused right in here?
Yes, sir.
Okay,
Just
focused right in there. Okay. All right. Now, scoot forward just a little bit for me. There you go. All right, so just kind of looking at your spine. So again, we looked at the x-rays previously. Now, in terms of that spine, we have a huge dip right into here. So that kind of causes the spine to lean forward. When that spine leans forward like that, then your body's going to compensate by getting this huge arch. Okay.
Mm-hmm.
Now, in terms of your x-rays, that's what we're seeing is that huge arch going over here. And as that spine moves forward and tilts forward, it's going to put a lot of stress into here. Okay. So we are going to want to work on this, but a lot of this becomes a compensation from this. Okay. So left long enough, a compensation can become a primary issue. And so I think that's what's going on. So we're going to get you scoped again. Each time you come in, we're going to get you scanned, as well as we're going to pull up your x-rays each time you come in as well. Okay. And you said the back's been going on since 2003?
Yes, sir. When I was in the Marine Corps.
The Marine Corps, man. Oh, I think I told you before, but I don't think I can ever say it enough, man. Thank you for serving, man.
Of course.
And we get neck and upper back tension too, or not as much?
Yes, yes, sir.
Okay. That needle just kind of flings right over there. So we're seeing some stress. So we have a little bit of irritation up here.
Mm-hmm.
We have a lot more down here. So like I said, this is not as big of a concern, although there is an issue that we're going to be addressing, but this is where the swelling and the inflammation, we're seeing a lot more here. We're going to push onto the spine. You let me know if there's any pain or soreness right away, okay?
Okay.
Again, here's our C6. Chin down a little bit more. 5, 6, 7. 5, 6, 7. Any soreness or pain on this?
No, sir.
Okay. Yeah, right there's your C7. That doesn't want to move too well. Good. Okay, so that C7, that's where we're going to probably take a look at on that neck. 1, 2, 3, 4, 5. I think we talked about this last time. Your pain tolerance is a lot higher than the norm, and so when that happens, we're not looking as much about tenderness as opposed to where the swelling is,
Mm-hmm.
where the restriction is of the joint, and where we're starting to see some of that stress from the reading from the instrument. So that actually helps us a lot, especially when people have a little bit of a higher pain tolerance. All right, so again, here's T11, 12, 1, 12, 11. Soreness on any of those?
Oh, yeah, that one right there.
And that one right here?
Yes, sir.
11. Okay. Right here, it's 5, 1, 5, 4. Which is the most tender, if any, on those ones?
4.
4, a little bit more.
Yes, sir.
Yeah, that's what I was thinking. Okay, so L4, that's this guy right here. So we talked a little bit about this, but when that L4, what it does is it's kinked back like this. When it kinks like this, what it's doing is it's sending your spine back, and that's why we're having this huge arch like we're seeing. Good. All right There's good. Bring your feet out in front of you just a little bit more. There you go. And chin down just a little bit. There you are. And then relax in there. Give me a little bit of a push, moving that forward, okay?
Mm-hmm.
There you go. Nice. That was a good clunker, man. I like that. Good, good, good. That's what I want to hear is the clunks. I don't want little clicks there. I want some good movement. That's how you know we get to the disc level of the spine. Alright. Rolling just a little bit. I won't drop you. And you're going to have you relax that shoulder. So I'm going to push up just a little bit. Don't want to roll you too much. Right there's fine. Alright, let that go. Yeah, a little bit of pressure here. Nice. You did okay?
Yeah.
Alright, man, coming up. Let's have you stand on up. I'm going to actually have you walk a little bit on that one. I'm going to get some of the swelling out of there, okay?
Okay.
So go and stand for me. You're just going to go ahead and walk back and forth from the wall to the computer here. Slowly walk back. Good. Keep going back and forth a couple more times. Alright, now just with that, how are you feeling in terms of that lower back?
Good.
Yeah.
Yeah. I've never had my hips pop like that before.
Really? Keep going back?
The neck I always do myself, like I crack it a little bit.
You do?
Yeah. I know it's bad.
Yeah, I don't recommend it. Alright, so you said you've been to other chiropractors, but they never actually adjusted your back? They just did the that pulling thing that you said?
Yes, sir.
Okay, gotcha. Well, hopefully we'll get some good movement on that and get some more swelling out of there. Yeah, that T11 is still there. So we're going to work on that T11 and then see how we do with that, okay?
Okay.
Eleven. Five. There you go. All right, so this might be a little sore here, okay?
Mm-hmm.
When we get that guy to move, sometimes this one, especially because it's been so kinked in that area because of the swaying of your back, that can be really tight here. So bring the arms down to the side. There you go. Good. Chin up a little bit. Breathing in. Let it go. Just gonna get a little test push here. Okay, good. You okay with that?
Mm-hmm.
All right, breathing in. Let it go. Let your belly just sink into the table, just drop. Let your shoulders relax. There it is. Just holding that a little bit. Good, cleared. Yeah, we still got some stress here, but we're gonna work on that later on. I wanna see how you do with just these adjustments. Good. Good stuff, man. Yeah, that's looking really good. Okay, so that's going to be it for today.
Okay.
So, in terms of the things that we did, again, we talked about this. Where did my little highlighter go? All right. So, we eventually will address the pelvis and the short leg on that right side. That's going to be something, like I said, we're going to want to bring that up a little bit to try to create more stability there. The ones we did today, one is going to be your C7. We did your L4. Again, that's the one where, I can bring this in a little bit more. That joint, it's pinched in the back, it's wide in the front. What that means is, again, is that L4, it's kinked back like this. When it kinks back, it's going to send your spine swaying back this way. Okay, so we're going to be pushing that spine forward, trying to get that back on top of L5 here, okay? And as we see that progress, my goal is to see if we can get that spine to move forward to get some of that stress off your mid-back here. Because again, that L4 sending that spine back, which puts stress on that T11 here. So if I can get that spine to move forward a little bit, that should take off that pressure there, okay? So let's see how that does. Now, your goal and your job, like I said, it's 50-50, man. So we did our part today.
Mm-hmm.
That's where it starts. So when you go outside, you do your stuff and stuff like that. One, I want you to ice. If you feel any soreness, any achiness, ice is your best friend. Helps to reduce the inflammation.
Okay.
But the biggest thing I want you to do is get some movement, walking around, okay? So if you're up in that tower or you're doing whatever you gotta do, I want you walking around, doing as much as you can, if you can, just to get movement in the joints. The more movement we have, the more inflammation we get out of there, the other part is when you're moving, all the work that we did is now unlocking your spine. So it's allowing your spine to move and undo all that stress that's been accumulating, okay?
Okay.
And then the last thing is we are going to get you connected on our membership portal. Has a bunch of exercises, health tips and stuff like that. I want you to get on that thing because there's a lot of health tips that we're going to be giving you, okay? So we'll walk you through some of that stuff later on, but at least for right now, I want you to get logged on to there.
Okay,
Cool,
sounds
man.
good.
Any questions?
No, sir.
Good stuff, man. You
All
did
right.
good, man. You did good. All right, well, let's get you going. Let's get you out of here, and we'll see you next time.
All right.